I'm Dr. Connie. I'm your host of Mind Your Health podcast. I share my unique perspective both as a practitioner and a patient battling autoimmune condition for over 25 years because I had to figure things out on my own, and my education in my practical approach as a patient allows me to truly integrate it so that you can be whole and the burden of sick care is no longer your own burden to carry. And this is what we help you with in this podcast. Hi, this is Dr. Connie. Today I want to talk to you guys about how your parents and their past trauma can affect you and cause generations of trauma that started with them, your ancestors, but then also leads into you. And so it can become such a deeply seated thing that I'm afraid many people don't recognize, or sometimes we don't even know to recognize, because there's so much conditioning around this and the guilt and shame for feeling the way you do. So I'm just going to break out into this topic with a little bit of what I've been feeling and what I've recognized. Immigrant family. I was separated from my parents when I was 6. They, both of my parents grew up in the Korean War. They were both little, and they had seen a lot as little people during the war, and they've seen some, I'm sure, horrific things during that time. So my parents were definitely affected by it, and I know that my maternal and paternal parents or grandparents were very wealthy, well-to-do, post-Korean War, but I also know that neither of the family really knows how to feel what they feel. We're not very emotional. In fact, showing emotion was a shameful thing. And having been a very emotional child and very curious at that, culturally I never really fit in. And so I didn't know that I was doing this, but I always told myself that I was unworthy because I wasn't the ideal Korean woman type, who's supposed to be very well behaved, very docile, and very obedient. I was none of those. But I had a twin sister who I was always compared to. And she was the exact replica of what my parents, or specifically my mom, wanted a woman to be. Very calm, very much like a girl, and, what have you. All that being said, I didn't know that I felt this way until it was later in life, and the choices that I would make in my life really reflected sort of my conditioning around a lot of these things. And I had to do a lot of work and coaching and counseling and therapy to figure out and get to the bottom of this. And no matter what I tried, because even though I'm very logical today, because of my educational background, I've had to force myself to be very logical. I don't think I'm a very logical person. I've always been a very creative, innovative, and very out there kind of, like, I don't see the world very two-dimensionally. I don't like convention. I always want to find a better way or create a better path, faster path. If it doesn't make sense, I'm going to always question, how can we do better, right? And I didn't have permission as a little girl to explore like that. It's just, I've always been coerced into accepting what was. And I had a very hard time doing that. And that conditioning itself led me to practice, for example, physical therapy for as long as I have in the context of conventional medicine, because that's the highest degree that I achieved. And it wasn't until later in my career that I was able to break out of that mold and have the courage enough to sort of do my own thing, because I saw that wasn't working, right? But it took a long time because I had one foot in, one foot out the other. So just to tell you a little bit about going back to my story with 6 years old, my parents in the Korean War, they had abruptly left the four of us I'm the youngest of four kids. I have a twin sister, and then I have an older brother, and then the oldest brother. And we all have trauma from that time because it was the hardest time of our lives. I barely remember anything. But my maternal grandmother didn't really approve of me because I was so rambunctious and I was out and about, curious. And she lived in very traditional Korean home with the sliding doors, no running water in the toilet. It was you squat, do a kimchi squat, and there's rats going down. It was like a poop dumpster, right? And for a little girl like me who's used to flushing toilets with no mom anymore and expected to go in the middle of the night with the rats chirping beneath you, like that was just not going to be very good. And so I remember feeling miserable because we had no way out. Nobody was really taking care of me in any way, and we were just pretty much left orphaned. I felt like don't have a whole lot of memory. Then we came to the States, and my mom was really, really, like I said, she's a very beautiful woman, and she really regards women to be very, or she believes women should marry well, have a good husband, and do that. But if you do the work or have a career, then you have to look your best, meaning you have to keep your shape after pregnancy, you have to keep your skin up, you have to keep your fashion up, and you have to do all the things, fix yourself to look your best. And I always felt like that aesthetics of a woman, like what my mom believed, wasn't really my belief, but I still wanted to please my mom. So, when your mom makes judgment calls about your body, you tend to listen, right? And I was the bigger boned one out of the two twins. And so it seemed like when we were growing up as teenagers, I was always struggling with my weight. My sister can eat whatever she wants, and she was as skinny as a stick, right? And so I was always compared to her, and I remember feeling really, really less than because of that. And it didn't matter what was said outside of the household. Whatever my mom said was the Bible, and that was the truth in my eyes. And I did everything to please my mom, and that meant I became hooked on working out since the age of 16. Jane Fonda was found, and then pretty soon there was aerobics, and I got into the fitness right after that as a way for me to keep my body shape and body image in check, especially get approval from my mom. And I think that can be healthy, but then I think also that was detrimental for me because it brought up a lot of anxiety. It brought up a lot of obsession. It brought up a lot of stress in my life because of it. There's still some things that I'm trying to condition myself out of that I believed so much as the truth back then, so much so that it's hard for me to get rid of the truth today. And I know many of you, if you're women like me, your moms had such a tremendous impact. But my mom especially, having had no English understanding, my mom literally, I feel like she wanted us to be the best we can, and really my mom wanted to live vicariously, specifically with me or through me. And so we've become really close, but then we clashed in ways because of the lack of, I guess, understanding of each other and the generations, and then lack of my ability to share what I really feel, because my mom believes a certain way, and she's really good about categorizing each one of us into a category of, oh, that's just Anne, oh, that's just Connie, and that's just James, that's just Charles, and they expect us to be in that little pigeonholed category, and we can never swim out of that, right? And it's kind of comical when we go to family gatherings that always comes up. But there's also a lot of resentments because I think one thing is true, being a parent is really hard. None of us got a manual when the little ones came out of us. We try to do the best we can, but one of the things that I try to do, and which is the topic for today, is to get rid of and understand some of those generational trauma. I remember getting really, really offended one time at a dinner table. Both of my boys are on the dinner table, and having been divorced, which is a very shameful scarlet A ordeal, which I've had to live through in my the most conservative family. My parents really didn't understand, but there was a lot of shame around it. And they were openly ashamed about it to a point where my mom would say, I don't tell anybody at church I have a daughter, because they don't want to talk about a daughter who's divorced. Versus before the divorce, she would tell everybody, I have a doctor of a daughter. And I was the pride and joy to go from that to now that I'm divorced, I don't get talked about because of that shame. I don't know if my mom ever thought about the impact that has on me, but I think it's one of those things. If you have moms, we just roll our eyes because they're our mom. What are we going to do, right? But I think it's also important for us to recognize some of these things and detach from that and understand how much it has nothing to do with our own self-worth, that's all they know. And to understand my mom from the standpoint of what she went through during the Korean War, growing up under my grandmother and her conditions, like I can better understand sort of where she's coming from too. And so if we can like almost choose to understand before we ask to be understood, I think that just places so much grief and trauma as well as suffering, just it can be neutralized in a flash. So I want you to remember that, Karen. But can your parents' trauma affect you? Yes. You've heard of the term, oh my gosh, it's scary how I'm being just like my mom, right? We don't like something that our parents did, and then you recognize that there's patterns that you do where you become just like your parents. And that's the conditioning that I'm talking about. It's not a conscious decision to be like our parents, but it becomes a subconscious belief in knowing that that's all we know. So therefore, this is how we're going to behave, and this is what's going to identify. This is what we're going to identify as, right? And so it's important to understand that nobody's perfect, but that our generational trauma coming from our parents to us needs to be reflected enough, especially if you have kids, so that we can break away from that generational trauma and start our own path so that we can be free from that. So there's a lot to be said about generational trauma, because that trauma can have an impact in your autonomic nervous system, your enteric nervous system, somatic nervous system, and even your psychology to affect your epigenomics. Epigenomics is your mutative change in your genetic makeup because of the traumatic background. So please understand that this is not something that I talk about and then we can just flush it out of our minds because it doesn't affect you. It affects you so greatly at the cellular level that I need you to listen, especially when it comes to all the things that we're talking about with the impact of trauma and the implications it has in your physical body. And then also understand your family dynamics and make sense of what that is. For me, every time my family gets together and with me going through what I've been through, I realized that there was such a disconnect, almost an insensitivity towards me. And it was done unknowingly by my siblings and my parents as well. Do I know that they love me? Absolutely, I do. But there was a lot of things that I realized I couldn't talk to them about because we've never been a family who speaks the truth. We've always been a family. When things are good, it's easy to get together during the holidays and just pretend like all is well. And I know that my family does that really, really well. Okay, avoid conflict at all cost. But truth started to come out, and there's been a lot of resentments and a lot of surprising emotions that I've repressed that's begun to take form. And I would just have explosive outbursts when I would get together with my family, and that truth couldn't no longer be held. And then I realized there was a lot of defensive mechanisms, and there were some hurtful things that were said unknowingly, and I just had to sit and make sense of, okay, how do I want my family dynamics to be? Knowing what they are. And again, it goes back to first seeking to understand first before you ask to be understood. And so I started to really work on myself so that I understand my trauma enough to embrace their trauma and how they're reflected. Because the truth is, four of us experience the same thing, but our perspective is very, very different. Our memories of those events are very, very different. And I realized that I had to learn and respect every one of them. That not one of us is right. It's just we all have differences. We're all trying to work through this trauma that we've had, endured, and we all have formed a coping mechanism. It's like a surviving mechanism for us to shield ourselves from that pain and suffering that we've all had to endure, right? And my parents especially don't want to talk about it. My mom would shut you down the moment you talk about it. And it's like, you can't talk about it in my family. So I've had to kind of create an outlet outside to really evolve and grow outside so that I can better understand my own anger and frustration and resentments and shame that was so built up in my cells to create and wreak havoc in my life as well as my health, and really get to the bottom of that. There's a lot of cultural narratives that I've had to live with and uphold, and they weren't mine to uphold, but they were just given to me. And to understand it and to separate myself and detach from that, that was work in itself. And I decided when my mom was at the table with my two boys, categorizing my boys, I put a stop to it, and I broke the cycle by talking back to my mom and asking her kindly not to do that. And maybe it was my tone, maybe it was something, but my mom, when I'm talking to her, it's almost like she gets really defensive, and it becomes very, the common popular word these days is gaslight me into thinking that I'm in the wrong. Or, she'll make comments like, oh, I'm such a bad mom that you probably don't want me around anymore, so let's just cut ties. So disowning me right in that point. And I remember being so sick after she did that, because I called her many weeks after. She wouldn't pick up my call. As a punishment, my mom would do that, like just give me silent treatment. But that is a form of very cruel punishment. It's manipulation. And I realized that there's a pattern to what my mom did, which is not okay, not with me. But I don't think my mom ever understood the implications of her behavior. So I can't even argue with what she did. So then how am I supposed to come to terms with it? I'm sure many of you have parents like that, because the more you talk about it, it's so close to them that you just can't have a serious conversation like that without it exploding into something so much bigger that I know personally that I can't handle when it explodes. So there's a lot of self-reflection that you might be doing.
Can you talk about how those patterns that your mom had, how that affected you in your thoughts, feelings, and behaviors?
Yeah. So coming back to when I said my mom had these patterns, the way she talked to me, or she'll withdraw communication or cut me out and stuff. She didn't realize that that brought up a lot of abandonment issues. Like back when we were left in Korea, I have abandonment issues, which led to me being codependent emotionally to my family. And that's not just my mom. I just became codependent with everybody. I like feel very insecure when somebody's leaving because of that memory that I had at 6 years old when my parents uprooted and left, and we were left with maternal grandmother. And the way my mom used to make me feel is, I felt like, oh my gosh, I would get so anxious, so OCD about my mom not talking to me forever. And I felt like, I can't even explain it. I would go into a panic attack, full blown panic attack as a grown woman with 2 kids. And I remember one of those times I ended up in the hospital because I drove myself mad in obsessing over why she wouldn't call me back. And all I needed for her to do was to call me back and to tell me everything is okay. And she failed to do that, ended up in the hospital. It wasn't until I was so sick in the hospital that she finally caved in, and then she was able to talk to me. But I don't think she realizes the extent to which she influences how I feel. Or I take that back. I think she knows, but she uses it to her benefit without knowing the implications or the impact it has on her daughter. And I think those are things that makes me want to evolve more and help people reach higher grounds with, because there's so many people that are hurting themselves, that are hurting other people unknowingly. And I think that can be stopped through the practice of yoga, which has certainly been my path to better understand not only myself, but really human nature as a whole. And I think that that's all I want to say about my mom for the time being. But again, I want to make sure that it's caused a lot of grief, a lot of conflict, a lot of disagreements, and a lot of angst and resentment. And I'm still working through a lot of the emotions that I have. But I've had to like really pull away and really set some healthy boundaries around myself and my mom and my family, to a point where they don't know how to come back to me right now. But for me, it's important for me to figure out how I feel first and foremost, and decipher exactly how I want that to look like going forward, because what has been is no longer working for me. It's that paradigm of what was. Now I'm here. I have to determine, where do I want to go? Because the last thing I want to do is go right back to where I was, repeat the same patterns and conditions, which is the easiest thing to do, but I'll not feel, knowing what I know now, because I'm here, evolved, I can't go back and pretend anymore, because to me that's a lie. And if it doesn't align with me, it just doesn't feel good. And if I don't feel good, I know that that's gonna negatively affect my body as well. I think trust and vulnerability is important, especially if you know you can trust them and that they are containers for your vulnerability. Not everybody is, and I've been vulnerable with a lot of people that didn't deserve my vulnerability. And that was a mistake on my part, but I had to learn to navigate those relationships as well. So really, really, really understand what trust means for you. And you'll know in your heart of hearts who you can trust. And it's those people that are silently there. And if you pull away and you disappear for a little bit, it's those people who ask you, how are you doing? And really with concern. They're really reaching out to you and really staying by your side. Second thing is your ability to communicate. And I assure you, not many of us have eloquently learned the art of communication. We didn't learn it in the home. And if we didn't learn it in the home, I don't care if you had communication major or communication classes, you're not going to learn interpersonal communication in a way that matters. Because communication in this context, I'm talking about authenticity and really honesty and speaking your truth. And just because, but many of you gloss over your truth to speak what they want to hear instead, because you're afraid what your truth is going to hurt other people, or they're going to frown upon how you really feel. There's a lot to be said about emotional intimacy, and make sure that that person is able to handle your emotions and the intimacy that you're offering. Because a lot of the times, if you're not careful, you might be triggered and you might be left to feel even lonelier than when you shared that emotion. And then I want you to really look at patterns and cycles in your life. Is there a repetition of patterns? Like, is there a constant unresolved communication barrier? Is there a tendency for avoidance and codependency in the relationships that you keep, right? These are things that you should look out for. And then you'd want to bring it all together to heal together. So sometimes healing isn't being one with that other person, it's allowing space for them while allowing space for you. You can't do the work for them. You can't heal on their behalf. You can't even ask for that person to give you what you need, right? It's just, do they give you what you need or not? And if it's a no, then it doesn't make them a bad person. It's just either A, do you feel comfortable communicating your needs if it's a significant other? Or is this relationship worth asking for these things? Do they care enough to give you these things? Is it worth your effort to work through? Because sometimes I found that some relationships, not so much. So it's best left alone, because you know where they are in their headspace and their growth. And sometimes you just have to let them be where they are. And our job isn't to change anybody else. Just please remember that. Last thing that I really want to talk to you about is the effect of trauma on your nervous system. Not just your nervous system. In this context, the nervous system includes the enteric nervous system, the autonomic nervous system, and the somatic nervous system. Nervous system as a whole. Trauma does live in the body. Your body does keep score. And a lot of women, especially autoimmune patients that I've treated in the last 25 years, every single 100% of them have had traumatic backgrounds that tied them in. But the doctors never include this trauma as something as the root cause. But I believe therein lies the complex etiology of all chronic illnesses, is the unspoken little t trauma as well as big T trauma, because we all have these traumas. And the stress responses, and then the ins and outs of autonomic nervous system and sympathetic nervous system and freeze or flight system, all the things play into gear, as well as the enteric nervous system, to affect change in the body to create these symptoms, but that sometimes we don't know where it came from, so we want to address it biochemically through medications and so forth, and that's the conventional world. But if you understand the traumatic nature and the impact it can have, you, my friends, can reverse the impact of this and start to step into your empowered self so that you can better navigate your life out of this, right? I want you to know sometimes it's hypervigilance, hyperarousal can happen because of trauma. Like everything is a flighty. Everything gets you so anxious. You're thinking about the worst case scenario, right? Some of us has hypoarousal, where nothing phases us. We're just like zombies going through life. And that is parasympathetic deficiency, which is the other end of the spectrum. And then I want you to understand that there's triggers to hypervigilance. It's a lot of the things. I'm very hypervigilant. Anything and everything used to trigger me. And I'm just very flighty. Like I will scream at nothing. In the movies, like I can't do so much. So or I can't do so much, what is graphic details, like in the movies, scary movies, when there's so many murders happening and stuff like that. Like all those gruesome things is really traumatic for my brain, and I get very flighty in movie theaters, and I know that that comes from my upbringing and my traumatic background. And the impact on physical health cannot be minimized. There's so many different things that you can do to help yourself out of this, but the number one thing is being aware of these tendencies. And I hope that me talking about my past and me learning about my traumatic background and how it shaped me today really helped to shed some light on what you may be going through that you didn't know how to place the words on, or even to understand what's going on with all the things that you may be feeling. So I hope this was all in all educational, beneficial, and informative for you. I do believe at the root cause of any dysfunction, especially gut health and stress-related diseases like autoimmunity, has root cause is the big T or the little t of any kind. So don't judge, because a lot of patients say, oh, that's so little, I don't have any stress. But I think some of us are so used to having the level of stress that is so high that we sort of diminish what it really is doing in our lives. So honor yourselves. No matter how small, how big, I want you to know that there is a way out. And as long as you become aware of it, we can definitely work through it and be better for it together. So I'll see you guys all next time. Keep practicing that yoga and be mindful.
Thank you for listening to the Mind Your Health podcast. If you enjoyed the episode, we would so much love it and appreciate it if you share it with someone who could benefit as well as to subscribe to this podcast on Apple Podcasts, Spotify, or anywhere else where podcasts are found. And leave us a review. We would be so grateful, and it helps us to reach more people just like you, so you can become more empowered to enjoy longevity and health. You can follow me on TikTok, Instagram, and YouTube at Dr. Connie Chung. And of course, you can subscribe to this podcast for a new episode every single week. Thank you again.